So the study is looking specifically at using a PET tracer of fluciclovine, which is used historically to diagnose metastatic prostate cancer. It's an amino acid PET tracer, and we felt that it had some potential use in terms of distinguishing tumor recurrence from radiation necrosis. The reason why is that we are using more and more stereotactic radiosurgery, and so radiation necrosis is a complication of stereotactic radiosurgery. When we see patients in follow-up, when there's an enlarging lesion, it could be radiation necrosis, it could be tumor recurrence. And having a reliable way of distinguishing between the two does allow us to get these patients treated more accurately and precisely quicker. And so we wanted to look at the use of fluciclovine PET to distinguish between the two. So what we did was we had a group of patients where we considered fluciclovine PET because we weren't really entirely sure whether or not that's tumor recurrence versus radiation necrosis, and gave them fluciclovine PET. And we're looking at how the tracer is able to detect between the tumor recurrence and radiation necrosis. In general, we're starting to see some signal that this could be a potentially useful tool in terms of distinguishing tumor recurrence versus radiation necrosis, particularly when you look at the SUV max, where it actually shows incredible uptake specifically for tumor recurrence. So the most common questions that people ask me about the study is this potentially useful? Are there other ways that we can help distinguish between the two? And the things that we have used historically just don't really do a great job in terms of distinguishing tumor recurrence versus radiation necrosis. So the best thing that we have is cerebral blood volume, and that just is unfortunately probably about 80–85% accurate in terms of distinguishing between the two.